Hi everyone, good morning, good evening, and good afternoon, wherever you are. We are welcoming you to this session as part of the World Federation for Public Health Week to celebrate public health activities and initiatives. As you know that the World Federation for Public Health Association is the only professional society dedicated to advancing global public health since 1967. It has more than 130 member organization and 5 million public health professions. So we are here to continue our mission to protect people and the planet, prevent diseases, and promote peace. So without any further ado, we will start our session today for how we can collaborate or can integrate the artificial intelligence within the public health. Welcome all of you.
Hey, welcome everyone. Thank you, Dr. Alan, for your introduction and introducing also the World Federation of Public Health Association. I will just introduce myself. I'm Alessandro Berioni, the chair of Young World Federation of Public Health Association. And today we're going to have an event on how to leverage AI and in public health. And especially we're going to hear some youth voices in that. So we're going to have a session of 3 speakers. The first one is going to be Dr. Alanud with her insight on AI in hospital management. And then we're going to have a second presentation from Dr. Lucia Rodriguez Borlado, that's going to introduce AI and NCDs, youth perspective. And finally, she's going to introduce the topic in French. And finally, we're going to have Antonio Bandeira from Portugal, that's going to introduce AI and misinformation, youth perspective. And the last presentation is going to be in English. This said, after all these 2 presentations, we're going to have an open discussion with the question and answer with open discussion. Actually, we invite you to open your camera and also join the conversation. So we will be glad to have more interlinked conversation altogether, most preferably in English. In the meanwhile, we're going to share also some details with you also to facilitate the discussion, and a survey to gather all the information from all of you, in case there are going to be lots of people interested to join the conversation. That's the point. So yeah, this is the overflow of the events. I will just start maybe with introducing the first speaker. The first speaker is Alanud, as I said, Al-Marzouki. I hope I have pronounced it correctly. Alanud is assistant professor at the University of Sharia, currently working as a member for the Middle East region at the Governing Council of the World Federation of Public Health Association. She has a PhD in healthcare management and has over 15 years of experience in healthcare leadership, healthcare quality, and public health innovation across the United Arab Emirates. So Alanud has worked a lot also with the Ministry of Health and Prevention and the Dubai Health Authority, where she has led like major hospital accreditation project, digital transformation initiatives, and her research are mostly focused on healthcare, electronic health records, mental health, work-life balance, and there's several publications in peer-reviewed journals. Also, she's a frequent speaker in international conferences, including the UAE Government Leadership Program and many others. So this said, I would like to leave the floor to Dr. Alanud Al-Marzouki, and have a good presentation. Thank you so much.
Thank you, Dr. Alessandro, for this introduction. I will be now changing the tone. I will speak in Arabic. So welcome everyone. مرحبا everyone. أهلا وسهلا. اليوم سوف نتحدث عن الاستفادة من الذكاء الاصطناعي في الصحة العامة، وجهات نظر مختلفة للشباب والفرص المتاحة في هذا المجال. قطار الأفكار أو الأفكار التي سوف نتحدث عنها سوف نعطي خلفية عن الصحة العامة، مفهوم الصحة العامة، ومفهوم بسيط عن الذكاء الاصطناعي كذلك. ومن ثم سوف نتحدث عن الترابط ما بين أو التقاطع ما بين الذكاء الاصطناعي والصحة العامة، وسوف نقوم بالتركيز على دور الشباب والمخاوف الرئيسية أو المحاور الرئيسية التي ممكن التحدث عنها. سوف نذكر أنفسنا وأنفسكم بمفهوم الصحة العامة. الصحة العامة هو مفهوم يرتكز على الوقاية من الأمراض وتعزيز الصحة على مستوى السكان، حيث لا يرتكز على لا يرتكز على الرعاية الصحية للأفراد، على خلاف الطب الذي يرتكز على الفرد نفسه. فيهدف أو تهدف مفاهيم الصحة العامة إلى خدمة المجتمع بأكمله. هذا هو الإطار العام للصحة العامة، يشمل العديد من المكونات أو العناصر، من ضمنها تطوير السياسات، ومثل سياسة ضمان الحصول أو حصول المجتمع على مياه نظيفة، استنشاق هواء نقي، بناء القدرات من ناحية القدرات المتعلقة بالمباني الصحية أو المراكز الصحية، أو القدرات المتعلقة بالطاقم الطبي من حيث تعليمهم وتدريبهم. وأيضا يوجد جانب متعلق بالخدمات الأساسية التي يقوم بها أو تقوم بها الصحة العامة، مثل الحماية، الحد أو منع انتشار العدوى، وتقديم الخدمات الصحية على مستويات متعددة. هذا بالنسبة حق مفهوم الصحة العامة. عندما نأتي ونعرف الذكاء الاصطناعي بشكل جدا بسيط، وفي خلال 10 دقائق فقط من هذه الورشة، صمم الذكاء الاصطناعي لمحاكاة التفكير البشري، أي أنه يلعب دور رئيسي في القيام ببعض المهام مثل اتخاذ القرارات. وأقصد بالقرارات هنا القرارات الصحية المتعلقة بقرارات يقوم بها الطبيب، أو القرارات التي يقوم بها مزودي الرعاية الصحية الأخرى. وتوجد عدة أنواع من الذكاء الاصطناعي مثل الماشين ليرنينج أو التعلم الآلي، حيث أثبتت الجميع الدراسات والأنشطة فعالية الذكاء الاصطناعي في التشخيص المبكر، وبالأخص في الأمراض الغير سارية مثل أمراض السرطان. أحيانا يساعدنا الذكاء الاصطناعي في التنبؤ بالأمراض، اختيار العلاج المناسب، وأيضا تحليل الصور الطبية. السؤال الأهم الآن، كيف يتقاطع أو كيف يترابط الذكاء الاصطناعي مع الصحة العامة؟ بالإمكان دمج هذه التقنية مع مفاهيم الصحة العامة من حيث التنبؤ بالأمراض. ممكن يمكننا الذكاء الاصطناعي باستخدام البيانات الضخمة من توقع بعض الأمراض التي سوف تحدث بناء على تقارير سابقة أو تاريخية. يساعدنا الذكاء الاصطناعي إذا تم استغلاله بشكل أخلاقي وبشكل ممنهج في دعم الصحة النفسية. أيضا يساعدنا الذكاء الاصطناعي في إدارة الموارد وتخصيصها بشكل سليم وعادل بين المجتمعات. وأيضا يساعدنا في فهم السلوكيات الصحية والرؤى التي ممكن أن تواجه مجتمع الشباب. بالنسبة للتنبؤ بالأمراض، كما تعلمون أن أمراض القلب والشرايين تعتبر السبب الرئيسي للوفاة عالميا، حيث يوجد 1 من أصل 3 وفيات يعود سببها إلى أمراض القلب. حاليا منظمة الصحة العالمية ذكرت بأن هناك توجد 17.9 مليون وفاة عالميا خلال السنة من أمراض القلب. فلكم أن تتخيلون كيف يمكن أن يكون الوضع إذا قمنا باستخدام الذكاء الاصطناعي باستخدام خوارزميات مختلفة مثل الماشين ليرنينج الجوريثم والديسيجن تري. هاي بعض التقنيات المستخدمة في الذكاء الاصطناعي للتنبؤ بهذه الأمراض والحد منها ومن انتشارها. كما يدعم الذكاء الاصطناعي الصحة النفسية، وذلك عن طريق روبوتات الدردشة والمساعدين الافتراضيين الذين ممكن أن يتم تدريبهم أو يتم برمجة هذه الدردشات أو الشات بوت التي يتم استخدامها في تقديم رعاية صحية نفسية على مدار الساعة. وأيضا تدعم المتخصصين مثل الأخصائيين النفسيين وأخصائيين العلاج النفسي في دعم المرضى بهذه الطريقة، حيث تساعد هذه التقنيات في التشخيص المبكر وفي في تبني أساليب بالإمكان أن نستطيع أن ندرس أو نفهم بعض التلميحات التي ممكن أن نستشفها من خلال وسائل التواصل الاجتماعي لبعض الحالات التي تعاني مثلا من أفكار انتحارية أو غيرها. فيساعدنا الذكاء الاصطناعي عن طريق التحليلات لهذه التفاعلات عن طريق التواصل الاجتماعي أو عن طريق البيانات التي نحن نقوم بإدخالها لهذه المنصات. أيضا بالنسبة للموارد وإدارتها بفعالية في القطاع الصحي، تستطيع أنظمة الذكاء الاصطناعي تقنين هذه الموارد، مما يدعم موضوع تخطيط الموارد الصحية بشكل أفضل وبشكل أكفأ. مثلا يساعدنا في التنبؤ بعدد الحالات التي تتعذر أو تتخلى، يعني بعض المرضى يتخلفون عن حضور مواعيدهم في وقتها الصحيح، وذلك يشكل تحدي، حيث الموعد الطبي يعتبر كموارد أساسية. فبالإمكان الذكاء الاصطناعي يساعدنا في التنبؤ بهذه سلوكيات المرضى وتحسينها في المستقبل. أيضا يساعدنا الذكاء الاصطناعي في فهم الرؤى السلوكية حول صحة الأفراد والكشف المبكر للعديد من المشاكل. أيضا في الأنظمة الصحية توجد تطبيقات يتم تسميتها بأنظمة الدعم. أنظمة الدعم هاي تعرف باللغة الإنجليزية بالكلينيكال ديسيجن سبورت سيستم. بالإمكان تدريب هذه الأنظمة بحيث تحاكي القرارات التي يتم اتخاذها من قبل المهنيين. توجد عدة أبعاد لاستخدامات الذكاء الاصطناعي، فيأتي هنا دور الشباب كسفراء للتغيير والمتمكنين تقنيا من هذه التقنيات، سواء كانت تقنية الذكاء الاصطناعي أو الأفرع الممتدة منها، حيث لدى الشباب الرغبة والإمكانيات في استخدام الأشياء الجديدة أو الأدوات الرقمية، ونود أن يقودون هذه المجالات عن طريق تعزيز التعليم، معالجة العدالة الصحية أو تحقيق العدالة الصحية، بحيث تكون البيانات متوفرة لصناع القرار. وأيضا نود من الشباب استغلال الفرص في استخدام هذه البيانات في أمور شتى. بالنسبة لتعزيز التعليم، يتضمن دور الشباب في تعزيز فهم الذكاء الاصطناعي وضمان استعدادهم لمواجهة هذه التحديات، الحد من التفاوتات أو الفروقات في الخدمات الصحية، فبالإمكان استخدام الذكاء الاصطناعي في تحديد هذه الفروقات وإغلاقها. أيضا توجد بعض الفرص أو التحديات التي دخلت مؤخرا، مثل تحدي متعلق باضطراب ألعاب الإنترنت أو الجيمنج ديس أوردر. فبإمكان الذكاء الاصطناعي الاندماج مع هذه المجتمعات والحصول على بيانات تساهم في التقليل من هذه الممارسات أو السلوكيات التي تجعل الأطفال أو المراهقين يدمنون عليها وتقلل من إنتاجيتهم. في الأخير أود إشراككم في خارطة طريق لنجاح قيادة الشباب في الذكاء الاصطناعي. هذه الخارطة وبعض الأفكار البسيطة، مثل تصميم حلول ترتكز على تحديات الشباب. إذا كانت هناك مشكلة صحية في الصحة العامة، يجب إشراك الشباب في تحديد هذه المشكلة وفي وضع حلول لها. تعليم الذكاء الاصطناعي خارج نطاق المدارس وفي المدارس، يعني مثلا بعد المدارس ممكن تصميم برامج ما بعد المدرسة لتعلم أمور إضافية متعلقة بالذكاء الاصطناعي، وبالأخص الاستخدام الأخلاقي للذكاء الاصطناعي. تصميم حملات أو قيادة حملات يقودها الشباب عن طريق حملات أو عن طريق مجتمعات محلية أو دولية. في الخاتمة أود أن أقول بأن تطبيق الذكاء الاصطناعي في مجال الصحة العامة يفتح عدة أبواب وليس باب واحد أمام تدخلات صحية أكثر تخصيصا لحاجة الفرد وللمجتمعات، وليحقق تعليم صحي أفضل ومزيد من العدالة في توزيع الموارد الصحية. ومع ذلك علينا أن نتذكر دائما أن استخدام الذكاء الاصطناعي يجب أن يتم حوكمته، ويجب أن يكون الاستخدام يكون أخلاقي وبفعالية وبعدالة، من دون أن نتعرض لخصوصية المعلومات الصحية لدى الفرد والمجتمع. وعليه نود أن نختم المحاضرة هذه بتشجيع التعاون بين قطاعات مختلفة، قطاع علوم الحاسوب، قطاع الصحة، والقطاعات الأخرى في قيادة التحول الرقمي في القطاع الصحي أو في الصحة العامة باستخدام الذكاء الاصطناعي.
Thank you for your insightful presentation. Yes, we will have a further discussion in hand in English, so we can also interact and understand better also what are the connection between the several sessions, even though the language is different. But I mean, Following this, I would like also to introduce the next speaker that's going to address a presentation on AI and NCDs, which are really much interconnected to hospital management and management of patients, which is something that actually is the core of the AI of the NCDs management with patients and preventions and so on. But I don't want to spoil anything further, so Lucia is going to introduce some topic about this. Just to introduce the speakers, Lucia Rodriguez Borlado is a public health medical resident at the 4th year of residency. She's currently working on non-communicable disease at the health division of the OECD, with experience in international health policy through roles at the French Ministry of Health also, and her participation at EU joint actions. She focused mostly on health prevention, non-communicable disease, sustainable health systems. Her work particularly centers on socioeconomic determinants of health, in which she advocates for evidence-based policies that integrate public health with broader social economic frameworks to promote actually long-term and well-being. So really much on point with this presentation. I would like to, yes, introduce Lucia, and Lucia, over to you. Leave you the floor. Thank you.
Thank you, Alessandra, for the presentation. Hello, everyone. Good morning.
French. Yes, you're gonna say that.
Yes, indeed. So I am originally from Spain, but I am working in France. So I will take this wonderful opportunity of this multilingual presentation to do my presentation in French. Bonjour tout le monde. Aujourd'hui, je viens vous parler de l'intelligence artificielle au sein du topic de maladies non transmissibles. Pour commencer, je voulais vous présenter les maladies non transmissibles en tant que fardeau de santé. Il faut savoir que les maladies non transmissibles, c'est la première cause de mortalité dans le monde. Ça représente 75% des décès non liés à la pandémie, donc c'est quand même non négligeable. Ça fait 3/4 de causes de mortalité dans le monde. Par ailleurs, il a aussi une morbidité importante, avec particulièrement certaines pathologies, notamment la dépression et l'anxiété, mais aussi le diabète, qui sont actuellement en augmentation. Il faut mentionner que les maladies non transmissibles, pour la plupart, sont des maladies chroniques et qu'elles sont toutes aussi multifactorielles. Quand on parle de multifactoriel, on a un cadre théorique qui nous est présenté, qui est celui de déterminants de la santé. Je ne veux pas rentrer dans les détails, mais les déterminants de la santé, ce sont des conditions qui sont appliquées à différents niveaux, que ce soit au niveau plus personnel ou au niveau plus populationnel, et qui vont venir impacter les résultats, les statuts de santé des populations et des personnes. Quand on parle de déterminants de la santé, des maladies non transmissibles, il faut évidemment qu'on les prenne en compte et qu'on fasse une approche holistique et intégrée des maladies non transmissibles avec 3 phases. Donc, une première phase de prévention de maladies non transmissibles pour éviter d'en arriver à l'apparition de cette maladie. Une deuxième phase de traitement en aigu de l'événement de la maladie non transmissible, de la crise. Et puis une troisième et dernière phase d'accompagnement lors de cette maladie qui s'avère chronique et qui dure dans le temps pour le patient. En fait, au niveau des maladies non transmissibles, on va avoir cette approche holistique et transversale pour venir les prévenir et les traiter de façon performante. Donc jusqu'à présent, on a bien parlé de maladies non transmissibles, mais on n'a pas encore parlé d'intelligence artificielle. L'intelligence artificielle, elle va venir impacter ces 3 phases cette approche, donc la prévention, le traitement et l'accompagnement. Je vais faire un petit zoom sur chaque phase et le rôle de l'intelligence artificielle dans chacune d'entre elles. Pour commencer, au sein de la prévention, qui, à mon avis, est quand même le centre de la prise en charge de maladies non transmissibles, puisque c'est le seul moment où on peut vraiment empêcher la maladie d'exister. C'est-à-dire, en général, comme je le disais, les maladies non transmissibles sont de maladies chroniques qui durent dans le temps, qui ne peuvent pas se soigner. Donc, en fait, la seule façon de vraiment réduire en prévalence, c'est de s'attaquer au niveau de la prévention. Au niveau de la prévention, l'intelligence artificielle a 2 principaux points positifs. Donc le premier étant l'utilisation de données pour prédire les risques d'apparition de maladies non transmissibles. Ces données, elles peuvent être des données de santé, mais également de données qui ne sont pas forcément liées à la santé. Donc, on l'a vu avec les déterminants de la santé, nos résultats de santé, nos statuts de santé ne sont pas impactés que par des conditions personnelles, mais également par des conditions sociétales, économiques, etc. Donc, il faut vraiment venir s'attaquer aussi à ces facteurs-là et pouvoir utiliser des données de tous ces différents domaines pour pouvoir prédire les risques d'apparition de maladies non transmissibles. Un exemple très clair serait, par exemple, les données liées à la santé environnementale, enfin, à l'environnement appliqué à la santé qui permettrait de voir quel est le risque de certaines maladies, notamment l'asthme ou certains types de cancers. Par ailleurs, il y a aussi un rôle non négligeable de l'intelligence artificielle qui connaît un essor en ce moment, c'est l'aide à la gestion des facteurs de risque. Encore une fois, comme le voyez, les maladies non transmissibles sont très impactées par nos conditions de vie et notamment par la nutrition, l'alcool, le tabac ou encore l'activité physique. Et l'intelligence artificielle va pouvoir implémenter des outils pour nous accompagner dans la gestion personnelle de ces facteurs des risques. Dans ces cadres-là, je voulais mentionner quelqu'un très proche à moi, ma maman. Elle vient de se faire opérer de la gorge et elle est actuellement en sévrage tabagique. Et elle me parlait le jour de son utilisation de ChatGPT pour se faire accompagner au sein de cette démarche. Et en fait, elle parle avec ChatGPT pour lui dire: bah, ça fait 3 jours, 4, 5 que j'ai pas fumé et en fait, ChatGPT lui répond avec des questions: «Comment tu te sens? Quels symptômes, tu as aujourd'hui?» et ça permet d'avoir une conversation, qui, elle, la rassure, et l'accompagne. Certes, les intelligences artificielles sont nourries, des données et ChatGPT n'a pas forcément des données, médicales validées scientifiquement et c'est là qu'on rentre en jeu, certaines nouvelles, applications, nouveaux outils, notamment, Kitoxil qui est une, application justement pour l'accompagnement, des patients en sévrage, tabagique, qui permettent d'avoir, plusieurs facteurs, liés à la personne, notamment, l'épargne économisée par le sévrage tabagique, les jours de sévrage, mais aussi des conversations qui pourraient être personnalisées pour la personne qui est en sévrage tabagique et qui aurait potentiellement des questions sur cette démarche. Donc voilà pour cette première phase de prévention, mais l'intelligence artificielle va aussi impacter les événements aigus, que ce soit dans la prise en charge ou dans le traitement. Donc, d'un côté, l'intelligence artificielle est actuellement utilisée comme aide diagnostique et je dis bien aide diagnostique. Aujourd'hui, c'est quelque chose que les professionnels de santé utilisent, avec l'imagerie médicale, mais qui aujourd'hui, n'est pas du tout autonome. Donc ça reste une aide, qui permet aux professionnels de santé, humains de aller plus vite, aller mieux, avec de meilleurs résultats. Du côté du patient, on va pouvoir avoir aussi des solutions pour améliorer l'adhésion au traitement et également pour identifier les complications liées à ces traitements. Il faut savoir que quand on parle de cette adhésion au traitement, il y a plusieurs études qui ont démontré que le fait d'avoir une plateforme d'accompagnement basée sur l'intelligence artificielle améliore vraiment de façon significative l'adhérence au traitement des patients avec des maladies chroniques. Donc c'est un outil à exploiter par les professionnels de santé dans le futur. Pour finir, l'intelligence artificielle, impacte également l'accompagnement, des patients lors, de leur pathologie, chronique, notamment, sur, le suivi, de la maladie de patients, que ce soit dans leur questionnement, par rapport à comment la gérer, leur traitement, mais aussi leurs rendez-vous, et bien d'autres choses qui peuvent impacter la vie quotidienne des patients, avec une maladie chronique. Ça peut également soutenir, les professionnels de santé dans la prise de décision et améliorer le suivi de leurs patients tout au long du système de santé. Il faut savoir que les maladies chroniques et les maladies non transmissibles sont des maladies qui font vraiment le lien entre l'hôpital et la ville. Donc en fait, d'avoir un outil qui nous permet de faire ce lien et de donner des informations sur les patients aux professionnels de santé améliore vraiment la prise en charge, des patients et la facilité de la prise de décision de professionnels de santé. Je voulais, dans ces cadres d'accompagnement, vous présenter quelqu'un. C'est Vic. Vic, c'est quelqu'un, c'est un accompagnateur de poche pour les patientes qui sont atteintes d'un cancer de sein. Et en fait, il vient vraiment faire des rappels des prises médicamenteuses, des rappels de rendez-vous, des rappels des bonnes pratiques et des bonnes habitudes au sein de la vie des patientes et qui aide énormément des patientes en France et actuellement à l'international également. Donc on a parlé de cette IA qui a un impact sur la prévention, le traitement et l'accompagnement. Donc c'est en général assez positif, mais il faut aussi parler des risques et des points d'attention qui sont à tenir en compte quand on parle d'intelligence artificielle. Pour commencer, l'intelligence artificielle, je disais tout à l'heure, c'est un outil, ce n'est pas une solution, ce n'est pas une fin en lui-même. Il faut vraiment que ce soit quelque chose qui rend la médecine plus humaine et non pas moins humaine, et donc qu'elle puisse appuyer les professionnels de santé dans ce qu'ils font, qu'ils libèrent du temps humain pour que ces personnes puissent aider les patients, mais à aucun moment substituer la relation des patients avec les professionnels de santé. Par ailleurs, quand on parle d'intelligence artificielle, il faut parler inégalité de santé. On sait que les intelligences artificielles sont nourries de données et que ces données peuvent et sont biaisées, notamment par rapport aux minorités. Donc, il est notre rôle en tant que jeunesse dans la santé de s'assurer que ces inégalités de santé ne sont pas aggravées par l'utilisation de l'intelligence artificielle. Et tout en restant sur des minorités, on a aussi la question de l'accessibilité des certaines populations. Si on parle d'intelligence artificielle, il faut qu'on parle de littératie numérique et d'accessibilité des populations démunies à ces outils. Par ailleurs, on a des outils qui sont très nouveaux et qui peuvent créer une sorte de manque de confiance dans notre population. Il faut aussi, nous, qu'on travaille à créer des outils qui méritent cette confiance de la population, mais également à communiquer avec la population pour qu'ils aient vraiment cette confiance envers les outils. Et pour finir, je voudrais parler du cadre légal, notamment par rapport aux données de santé. Aujourd'hui, moi, je viens d'Europe, donc c'est un environnement très particulier pour tout ce qui est données de santé. Euh, il faut qu'on parle des sécurités dans son sens large. Là-dessus, je voulais parler des données de santé. Donc, 30% des données de santé sont des données, pardon, de données mondiales sont des données de santé. Et parmi ces 30% de données de santé, il n'y a que 3% qui est aujourd'hui exploité et utilisé. Donc, il faut qu'on se dise que 29% des données mondiales ne sont pas utilisées au service de l'intérêt public ni pour la prise de décision. C'est vraiment un gâchis des données qu'on récolte. Et dans ce cadre-là, il faut vraiment qu'on se pose la question de la sécurité, non pas uniquement des données, mais également de la sécurité des patients. En tant que patient, on attend de nos données qu'elles soient protégées, mais qu'elles nous protègent également. Donc, je veux bien vous donner mes données, mais je veux savoir qu'elles vont venir proportionner quelque chose de positif sur ma santé et la santé de la population. Donc, il faut aussi sécuriser les données, mais aussi s'assurer que l'utilisation secondaire des données est possible dans des conditions sécurisantes. J'ai fini sur ça. Je vous remercie de votre attention et je vous laisse mon mail au cas où vous auriez des questions. Thank you very much, Alessandro, and over to you.
Thank you so much, Lucia. It was very insightful. Thank you. Especially, I was looking at the last slide, the fact that only 3% of the health data is used is very much interesting, and it means how much we can also move forward, the usage of AI and the training of the data sets through the feeding of more data. Very interesting. We will comment more about that with also the other young people in this webinar. And now we would like to move to Antonio Bandeira, who's going to introduce us the topic on AI and misinformation. Antonio is going to present also work that we have done in the last few months that he has led on AI and misinformation, youth perspective in public health. So I would like to leave the floor to Antonio. Just before that, I will introduce him quickly. Antonio is a public health medical doctor resident in Portugal and also an MPH candidate at the Johns Hopkins University Bloomberg School of Public Health. Is passionate about leveraging technology and to expand equitable healthcare access. He has previously led continuity of care projects in mental health, nutrition, elderly care in Portugal, leading telemedicine and also leading telemedicine startup. He currently collaborates with the Center of Global Digital Health Innovation at Hopkins University, focusing on digital innovation in health systems. Recently has also led this 10-author global WFPHA working group, writing a commentary, as I was mentioning before, on the potential impacts of AI in addressing infodemics and misinformation. This said, I will leave the floor to you, Antonio. Thank you so much for everything and for finalizing this amazing article that we've done together with the Young WFPHA Working Group. Over to you.
Thank you very much, Alessandro, and good morning or good day, everyone. Yeah, so I'll skip this slide. Alessandro did awesome work, and let's move into the content actually. So we are in a era where generative AI is really taking a central spot. We can see that not only because of the growth in the publications that we see everyone focusing a lot in this potential of these new technologies, but also like even economically, the estimated impact is huge, and it goes from different areas of our society, from mainly some of the main areas where it might impact is in customer operation, marketing and sales, software engineering, product R&D. But this doesn't really matter for us because what will really impact the day-to-day citizen will be the consequences of this impact and this introduction of generative AI, even without us understanding it. So this is happening already because, as we know, companies like Google, Microsoft, Meta, or Apple are aggressively introducing these technologies in our day-to-day devices, in our day-to-day websites that we use, even in our search engine, in the search engines that we use. So all the information that we get nowadays is pretty much filtered by AI to some extent. So where does public health stand after this in this context? Like, where does information stand, and what are the risks that we foresee, and also what are the opportunities that we can understand? So to understand this, we put together a team of 10 authors from all across the world that you can see here, with very different backgrounds. I come with a short photo of each one so you get to know them as well. But we reflected on all the potential consequences of AI in information, on this new age of information, to help us understand again what are the potential risks and the potential opportunities. So first, we focus in understanding the information's ecosystems, and one of the main things that we focused on was understanding this information. So what we have to understand here is that this information is actually deliberate. It isn't random. It's strategic. So one of the main concerns in this extreme information age is that harmful industries or even ideological groups can promote false content to deliberately spread manipulative or profitable wise content to destabilize somehow our normal order. So also in a world where constant notifications, constant call for attention, our brains eventually take mental shortcuts, and we have to also learn how to deal with it, because they will follow what feels right, easy for the brain, and not necessarily distinguishing in depth what is right or wrong. So our attention in this age has really become a commodity. Platforms are optimized to keep us scrolling and not exactly to keep us informed, and we see it in the different ways news are presented to us every day, that we are much more called for some clickbait, let's call it like that, rather than for the actual informational content. And that has to do exactly with this excessive amount of information that we are facing, that our brain again has to find these shortcuts. So this opens the door for these disinformation, intended disinformation, to take place and take advantage of us. So other concept here is the concept of misinformation, which is slightly different because this one doesn't start with malice, but when for example people don't find trustable answers, they turn to whatever fills that gap, and that again also opens us to enormous amount of risks, because there's a lot of space where science, which is naturally conservative because it's part of what it is, will leave a lot of space, a lot of gaps that we have then to find, to fit with like untrustable information or untested information that will guide our thinking and our thought processes into things that are not exactly science-based. So the problem is that, again, this information is not exactly tailored for reliability or for trustability. It's tailored for clicks and not exactly for truth. But there are, and after speaking a bit about the potential risks that we are facing in this excessive information age, there are also a lot of opportunities with AI. So better AI decision can also help us tailor and figure out better how to manage this information, can also help us tailor better the education that we provide to our to our populations, and also can also help us write better regulations, like that we'll talk in a bit, that will help us rebuild trust in this in the system that we've been seeing has been threatened in so many arenas. So what are the societal impacts of these excessive amount of information? So as we see here, it is estimated that up to 1/4 of the information pieces we find online might be false or misleading, and therefore it's no wonder that trust in health systems crumbles. Um, these and worse than that is that this is not even a fair distribution. So vulnerable communities are the ones that struggle the most to access to reliable information, and therefore they are more exposed and least protected from these infodemics. So, but there's a path forward, definitely, and AI, given the amounts of information, it's probably the way to go. Example of platforms like Think ID from Google DeepMind, that focus exactly in understanding what are AI generated contents, what are actual human generated contents, and what are trustable sources or what are not trustable sources, are one of the ways that we can actually in a large scale implement solutions that help us to control this kind of information. Other opportunities are health promoters like Sarah, launched by WHO. I think it now has even another name, but the goal is exactly to have an AI helper that can be personalized to each background and to each reality, to help detect misinformation and promote reliable health content. So then we move with these 10 group of people, we move to understand better what would be the role of public health and medical professionals in LLMs and information ecosystems. So we asked 5 questions and we gathered different perspectives individually, and I'm summarizing all the answers from all these all these people came together. So first, the current LLM's role is still to be exactly understood in the day-to-day life of a clinician, for example. But what is expected in the short term is documenting faster, educating patients, and supporting diagnosis. So in public health specifically, the hope comes into tracking misinformation, predicting behavior patterns, and adapting risk messages in real time. But again, this process needs guardrails because LLM can scale accuracy, but LLMs can also scale harm. So we really need to ensure that they are governed well to make sure that we are scaling accuracy. So then we were looking into how does this can impact overall health, and we were mainly looking into extending communication to the populations, for example, helping with intake forms, helping writing records, automating follow-ups. So these will make really the consultation, the normal medical consultation, go beyond the 15 or 20 minutes normal consultation. So this is another opportunity that we see for AI. Additionally, it will also free time for patient interaction and also extend the literacy of the patient beyond, again, the strict interaction with a health professional with tailored message, virtual counseling, or real-time risk alerts. So, but again, we have to be super careful because while we might increase this efficiency, we have to be careful because we can just start seeing more patients without and transform this gain in efficiency in just a gain in throughput instead of focusing in improving care quality, which should be also a main focus of these opportunities. So how to regarding the integration of LLMs into the practice, what we main focused again was improve medical insight and clinical insight also through the summarization of records, understanding our patient better and in a more holistically manner than regarding the public health perspective, more focused in the prediction of risks and understanding of geographical pattern, for example, to enable early interventions as well. And also another opportunity that we discussed was the smarter system navigation. So sometimes our patients face a difficulty, which is guiding patients, either emergent or non-emergent, through the health system, and AI can definitely play a role here. So, but what are the concerns that we should focus here? And I really wanted to make this faster. So we have to understand that managing the data, and there's a lot of initiatives, as you can see here, takes a lot of risks because of course, we have to be focused in protecting also the patient's data because as I said at the beginning, there are a lot of corporations that will be using this data and many times to our good, but also we have to ensure that the individual has their own responsibility and their own access to manage their own data. So we have to prioritize people in the way we are regulating this space. So we have to ensure that national strategies align globally to some extent, because this is a global change that is happening, and having one country setting boundaries without the others next to them setting those boundaries will much probably lead to unbalanced access to these technologies. Hence, besides the imbalance, take risks that people are not aware of in their individuality. So other thing is also ensuring that as my colleagues also referred in a previous presentation, that AI has this representative training data, that it has bias checks and continuous validation and ensures transparency. So this is not a rich people revolution, but is actually a revolution for all. So lastly, the future of Gen AI, as we've discussed, is can actually improve medical practice, can also improve the public health practice, but it has to ensure that it respects all the communities in all backgrounds. So just really, really fast, our after all this overview, we call to action in 3 main areas. So including health literacy, starting as early as pre-university level, so people understand better, for example, if they are contacting with deepfakes, if they are contacting with AI-generated information. Also include AI education in all health degrees to understand and integrate it with all health topics, integrated in health topics in fields like computer science, fields like ethics and tech governance, because nowadays what we see is that all these areas that before were not very connected with healthcare nowadays have a lot of impact in healthcare through the information they generate or through the products they produce. So in research, we also again call to action to the incorporation of AI and ethic experts in the public health organizations. And in the policy part, we call to the really important need of international collaboration with global standards and practice, but also with, of course, a national flexibility that will give each country their own individuality. So lastly, also very important to ensure that this revolution is equitable, and the way we see this happening is through having regulatory guidelines from organizations from WHO or other World Bank or other international organizations that can guide us this path um, through the various countries. So all in all, what we really need to do is to balance our opportunity and risk with this technology, understand exactly what we must do with it, promote it in a responsible way. And in our view, our role as emerging leaders is essentially to focus in lead with knowledge and lead based on science and try to avoid jumping to conclusions. So we protect our populations as well to take the most advantage of this revolution that will not stop. So we really have to learn how to make the most out of it to our populations.
Thank you so much, Antonio. Very insightful presentation. There are many points, and I'm glad we managed also to present that, especially the part where you were mentioning also the need of regulation, which is very really much indeed needed, and especially during these times where we see that algorithms are like pervasively influencing our daily life, either social media or whatever. So very much interesting. But I would like to hear more about this, about some comments from the floor. So maybe in the next 10 minutes that we have left, I would like to hear some comments, some questions straight from the participants. And I will share immediately the survey link so that people can also feed into that. So we can hear some questions to the speakers, either in Arabic, English, or French. Most potentially it would be better for everyone if you could do it in English. Otherwise, you can easily raise the question in Arabic or in French, and we will try to reply maybe in English. That's what I would suggest. And yeah, feel free to start commenting or adding question. Okay, I see Elanud has raised their hands. Over to you.
Yeah. So really thank you for all of you. And I'm really interested about the misinformation presentation by Bandera. I was thinking about this, like, for example, when you've explained about the misinformation and disinformation, those information are occupying a huge amount of social media or websites. And I think that there is a great need to have a structured feed for correct and reliable information, specifically for something related to health and health issues. You've tackled a very important aspect of what is happening around, and we've heard about brain root. If you notice recently, they added this acronym or this definition, brain root. People, not necessarily maybe I will say healthcare professionals or maybe youth, they are tend to like check information, but they don't know. No one knows whether it's like accurate or not accurate, because the amount of disinformation and misinformation is more than the reliable and accurate. I think it's an area that we need to make sure that the predominant type of information has to be the accurate and precise information. It's really challenging, but what you've tackled is really something alarming and require attention. It's a comment for me.
Yeah. Yeah, that's definitely. I totally agree. Just to add on that, so in one of the slides we talked about the RGPD that the EU took lead on defending data rights of users and defending their right to consent the usage of their own data. And where I want to get with this is that I hope that the same way that RGPD stimulated other countries, like for example the Brazil data protection law that is focused much more based in this RGPD from European Union. I hope that the European Union Artificial Intelligence Act that was released just last year, after 5 years of work, I hope that they exactly are focused too much in that in the need for you being aware of what is AI generated. You have the right in their view that you should know this, like when you are accessing any information that is AI generated, or you're interacting, for example, with a chatbot or with news or in any way, you should at least be informed, okay, this is not a human, this was not written by a human. So this transparency is in this AI Act. And my example before, the same way that other countries follow the data protection rules in the European Union, I hope that other countries may also follow these steps in the AI regulation across the world, of course, allowing for development in the industries so we can take advantage of it, but to make sure that the advantage is spread out through everyone and not only focus in a small number of people that usually already have access to the healthcare and to the best information.
Excellent. You know what I'm thinking, Antonio? I'm thinking about, for example, I don't know whether the study is about systematic review or it's only a commentary article, because maybe you are speaking about a matrix, and that matrix should be shared internationally, what are allowed, what are not allowed, what sort of privileges each applications, whether it's Google or ChatGPT or whatever. I feel that those type of information or those matrix should be mapped across all the regulations in Europe, in Asia, and whatever. Someone has to work on that. And I think maybe as a group, we might work on that to collect all those policies together, to build that map, and to share it with the community. Because people has to know.
Yeah. Yeah,
People have to
yeah,
know.
that's a wonderful point. So what we did was in fact a commentary, and that is mainly because this space is changing so fast, and there are countries going both ways. So if you see European Union going very fast towards regulation and ensuring, which many people even consider going too much ahead in the regulation. What we saw recently, even in an international forum, precisely in Europe, was the US bringing their perspective and even going back in some of the small regulations they imposed in their country. So again, this information that is generated in one country nowadays, it's accessible throughout the world. So the risks are expandable throughout the world, but the regulations are very local. And that's why also we understood that there was a need for international alliance because, as I said at the beginning, the impact will be huge, will be across all industries, and that we can really stop, but we should make sure that we take advantage of it and guide it in the way that it benefits the public. So, but just to answer to what you just commented, I think the challenge here is that things are changing so fast that and even when we were writing this, some things were already like the US going forward with some legislation, then coming back with other legislation. So it's really a interesting space to follow up.
Yeah. Thank you. Thank you, Antonio.
Absolutely. I would
Thank you very much.
quickly about what also Alanut mentioned. We could be interesting, like moving forward this initiative with like getting back all this scoping, what are all these tools, and we can share with community. Let's see if it's feasible, but it could be also something interesting to move forward and to propose inside the Young WFPHA Working Group. I wanted to comment quickly also point that you mentioned about brain rot. The brain rot, that is the new term that is been identified at the end of the last year, 2024. And this is a personal opinion, but I wanted to share. I really think that sometimes most of the problem with this AI algorithm and social media is that we lack intentionality in the usage of social media and algorithms. We are completely driven by, so we are scrolling, following what algorithm wants us to show.
Yeah.
Instead, for example, I'm starting to use more ChatGPT where I can be more intentional in certain ways. This is not a solution, but I just to refocus and recenter the discussion not only on AI and algorithms, but also putting the focus on intentionality and AI. How can we be more intentional and not completely driven by AI, so have the control over the tool we are using? This is a topic I really like to discuss. I don't think we have much time of it, but I wanted to hear a quick comment also from Lucia regarding what we've been discussing so far, and if she has anything to share about this.
Yeah, thank you, Alessandro. Regarding, well, you were discussing legislation and how to regulate data. I've been going through a lot of thought about this lately, because as I showed in my presentation, data is not really being used, especially not health data. Compared to any other data and other topics, honestly, 3% is not a lot. It's very sensitive data, so we need to make sure that we protect it, but we need to make sure that we protect humans over data. I think we need to ask ourselves the question of, when we talk about security and we talk about securing the data, are we making the most for the population out of that data? Because obviously I wouldn't want to have my own personal health data falling into the wrong hands, but I also want to make the most out of it. So if I have 30% of world data and I'm just using 3% and I'm regulating it more and more and more, I think we need to ask ourselves, how do we regulate it in order to facilitate secondary use of health data and not stopping evolution and progress? So yeah, I think it's more of a comment and like an open question, because I feel like it's a very complicated scenery where we have a lot of private sector and a lot of societal fear out of like what could happen with this data, but we're also sometimes refraining ourselves from advancing in some topics. For example, research. A lot of researchers are struggling a lot to get some data. So I think our regulation needs to evolve not towards a more conservative way, but more into like, well, you were using the word intentional, but like we're more intentional. Like, how do we make sure that we use our data to secure the security of the people, but not the security of the data? I think it's a complicated topic for sure. I don't think we will solve it here. But I think the question is to be asked, because I think, well, no, I actually think well, Alessandro, you and me are from Europe. Well, Antonio originally comes from Europe as well. We come from an environment that protects data so much. And I think in that sense, we come from a place where we are used to that. I think it's also interesting to kind of like think of like different ways of doing that and making sure that our data serves the population as well.
Thank you so much, Lucia. I think it's time for closing because it's 1 p.m. o'clock at Central European time. Maybe I will let Alanud address the final remarks for the closure. And yep, and then we can easily close the meeting. I don't know if someone is comfortable about open their camera and then take a picture. Oh, I let you lead from now forward. Alanud, over to you.
Yeah. Thank you, Alessandro. Thank you for all the panelists for your insightful presentation, talks. As Lucia said, we're not going to solve a lot of issues here, but most of the information shared today, it's like, worthy to think about, to open maybe new project, to think about how we can close those gaps in regulations or in like how those information are misleading the public health or misleading the policymaker, whatever, it's from both sides. And as Alessandro said, for example, we can lead like, a campaign toward a more intentional usage of those data from both sides, from individual and from like, public health association. So really, I would like to thank all of you for your insightful presentations, for Alessandro for moderating the session. And that's it. Really, I wish all of you a wonderful evening or the beginning of the day with Antonio, and see you maybe in the future in another event.